Hi, my name is Camille Vetrano, and I am giving my presentation on the gender gap of cardiovascular disease. So, what is cardiovascular disease? It's more commonly referred to as heart disease, and it's actually made up of several types of heart and blood vessel diseases that can lead to very serious and fatal complications. These include heart attack, stroke, heart failure, and arrhythmia. And common treatments for these diseases range from medication to surgeries like bypass surgery, depending on the person's specific situation. So, some statistics about heart disease. Heart disease is the number one killer in the US for both males and females, yet it's still considered a man's disease. This can be attributed to its close relation with smoking and alcohol consumption and its relation with male, even though these are on the decline. So, women who experience heart attacks are actually less likely to survive than men. Um, this is due to very gendered differences in the age of onset, symptom presentation, management, and outcomes. Because women are underdiagnosed due to age of outcome and symptom presentation, they're often underrepresented in cardiological research, so they don't have management and treatment options that are tailored specifically to their issues. So while more commonly men of younger age groups are diagnosed with heart disease, there's a prominent increase in diagnostic in women older than 50. This is believed to be tied to menopause in some way. About 38% of women die within 1 year of an initial myocardial infarction or heart attack, compared to only 25% of men. And this graph on the side is actually showing the deaths in thousands from 1979 to 2003 from heart attacks. As you can see, both men and women heart attack deaths are on the decline, but women still die more often from heart attacks than men. So this can also be attributed to the symptom presentation of men and women, because these symptoms men experience are the ones that are included in studies normally. They're also the ones doctors are more normally looking for signs of heart attacks, even though women present very differently, which adds to the underdiagnostic. So men normally experience stuttering, extreme chest pains, pain in the left shoulder, arm, neck, jaw, or stomach, cold sweats, regular or irregular heartbeats, rapid or irregular heartbeats, dizziness, nausea, or stomach discomfort. While women often report that they actually don't have any chest pains at all in their heart attack symptoms. So, in a study done where they interviewed women after they had heart attacks, asking about the symptoms leading up to their heart attack, women stated fatigue lasting for several days, or sudden severe fatigue, sleep disturbances, anxiety, shortness of breath, gas-like pain, upper back, shoulder or throat pain, and jaw pain. The management and outcomes also have gender differences. Because women tend to underestimate their risk for heart disease, they're less likely to go to the doctor for it. And this again is due to its public knowledge of it being a man's disease. Women, specifically older women, are actually more likely to have comorbidities or more than one diseases, which limits the treatment options for them. Hospital mortality rates for heart attacks are worse in women at 16% than in men at 11%. And mortality for bypass surgery, which is one of the treatment options for heart disease in women, is nearly twice that of men. Women were also referred less often for non-invasive or invasive investigations than male, even though doctors knew there was heart disease symptoms present. So all of these factors kind of come together and put women at worse risk for dying by heart disease, and they also are underrepresented and underdiagnosed in the medical field because there's just not enough research done on their specific presentation of heart disease and the symptoms they are experiencing. Thank you.